Hey, y'all. Melanie Hale here. Welcome back to the Radiology Roundup podcast. This week's guest is Rayssa Salinas. Rayssa is the program director of the computed tomography program at Galveston College in Galveston, Texas. Rayssa has quite an extensive background in radiography, computed tomography, management, leadership, and as an educator. Her Master's of Management and Leadership is from Western Governors University. Her Bachelor of Radiography, Emphasis in Education and Management is from the University of Texas, MD Anderson. And her Associate of Radiography is from Galveston College. She plans to start her doctorate in the fall of 2025. I've personally known Rayssa for several years now. She and I used to work together in the past as educators, and it was such a pleasure learning from her. And I know that you're going to enjoy her today and the passion that she shares as a technologist and as an educator. So please dial in and help me welcome Rayssa Salinas. Rayssa, welcome.
Thank you. Thank you, Melanie. Thank you for having me.
Absolutely, absolutely. So Rayssa actually worked for me at when I had another position, and so blessed to have her on our team as an educator and working with students back during that time. And I'm going to go further back with you though, Rayssa, and your career. And so let's step off where we are for now and go like back to what led you down the path of radiography. What started you down that road?
I think I was a little bit lost when I started college. When I was young and in high school, there was three careers that everybody thought that they were going to do. You were either going to be a nurse, you're going to be a doctor, or you're going to be a lawyer. And there was no really in between. That's what everybody talked about. So I had no idea the vast scope of radiology. I ended up going to Texas State for business. And I was bored. I was like, there's no way I can do this and sit at a desk and just look at numbers for the rest of my life. So I was like, let me take a reset. I'm going to come back home.
Mhm.
And a couple of my friends were starting the nursing program. I knew nursing was not for me, but I started to look at some other programs that were being offered. And I saw radiography and I was like, that has to be easy, right? Like what's the most that we can do?
Sure. It's
I
not being
got
a nurse.
I got a very rude awakening. I was like, my friends were like, oh, I'm so nervous. The program's going to be so hard. And I was like, I'm just going to do radiography. It's going to be simple. It's going to be a good job. Like, fantastic. And then I started and I was like, oh, this is not what I was expecting. I can't believe what we do, what our reach is, how many patients we touch every day,
Yep.
how many directions you can go in radiography. And I just fell in love with the field, with, achieving that perfect image, which being able to catch some pathology and notify the doctor, escalate the care. And I absolutely fell in love with the career. But I fell in love with teaching as a student also. I would help my peers. And I remember I would make notes for the class and everybody would copy my notes. And I even have some.
I wish I had you as a classmate back in the day. That would have been so helpful. I'd have been your first tutoree.
I loved it. And I remember vividly telling my instructor, I'm going to take your job one day. Not maybe from you, but I'm going to be your peer, or I'll be here with you, or maybe after you leave, but I'm going to do this one day. So I always had the educational track in my brain, but I spent 14 years in the hospital. I worked in radiography and computed tomography. CT is where I found my niche. I'm a pathology junkie, so that's where you see most of the crazy pathology in the field. And I absolutely loved it. So I started working with students as a tech. I got an opportunity to become a part-time clinical instructor.
Mhm.
I was able to start on that route. And then I became the CT program director. And I did some tutoring on the side, some freelance stuff. But at the end of the day, just creating content, making that connection for my students has really been my favorite part of my career so far.
That is awesome. I mean, from early on, you knew you wanted to be on the other side of that and be an educator. That is incredible. If you know that at the beginning, yeah,
The instructor I told that to is actually my peer today, and she vividly remembers that. I remember when you told me as a student that you were
mhm,
gonna take my job, and I was like, "I told you I'd get here, but I have a goal. I'm gonna get there."
that is awesome. That is
Yeah.
awesome. So I'm going to break down what you just said. Everybody you knew was going to be a nurse, a doctor, or a lawyer. What a high school you must have gone to. People I went to school with are thinking, well, that one's going to prison. That one, the judge, jury's out on, and not anything negative to my Apple Springs High School friends and back in the day. But yeah, we didn't have aspirations like that. We just wanted to get done with high school. And so, wow, that's incredible. That's incredible. But you were mature enough at that time to know that business was not the track for you and to do a reset. And I love that you mentioned that because and I will use people close to me. I'm gonna leave it right there. That I wish in today's world would say, you know what, this isn't the path for me. I need to do a reset, but I'm going to explore what might be something that sounds interesting to me and look at that. So I don't know. I think in today's world, there is maybe too many avenues of information, and maybe they don't always find the right information going down said avenue instead of going to a local community college and saying, when are your monthly information sessions on, you know, drilling platform or truck driving or your allied health and just fill it out and see what is right. And instead we have all of this at our fingertips and it may or may not be accurate because I don't know about you and I'm chasing a rabbit here, but I look at the Facebook pages at night and it hurts my heart.
Absolutely.
It hurts my heart to see, first of all, disgruntled technologists. Second of all, students that are just, oh, I chose the wrong thing. It's not going, I can't do this. It's awful. All this anxiety. And then, just the comments. And I'm thinking that would discourage anyone. If I'd have seen that at night, every night, I don't think I would have gone through X-ray school, or much less realize, keep going, you can do this. Keep going, you can do this. And so it's kind of discouraging, I think.
Or on the other side of that, when students are like, "Well, how much money do you make?" "Okay, I'll do that." But it's not about the money.
Yeah.
It takes a very special person to work in radiography or any imaging field. So if they're doing it for the wrong reasons or getting
Mhm.
some information that's not, what's really valuable in the career, then that takes a toll on the field in general. So if you're not
Mm.
meant for this, you don't love what you do, then you become that disgruntled tech who's not taking good care of your
Yeah.
patients, who's burnt out, who's ready to leave the field.
Mhm.
So sometimes people choose this career for the wrong reasons. And I think that we really need to know what it entails, why it's important. And if it's not for you, find something that is, because that's
Yeah.
super, super important. If you love what you do, you're never going to get burnt out, even on the busy
So true.
days, on the long shifts. You love what you do,
So
so
true.
it's not meant for everybody, but the people that are meant for really do make a difference in healthcare. And I really do believe that.
Absolutely. Couldn't agree more. And, I just will stress and then move on. Guys, if you're out there listening and you're thinking, oh, maybe radiography for me is for me, or CT or whatever, um, go to a reputable source, go to the local community college and ask those questions. See if this sounds like something that might connect with you. And if it doesn't, that's okay.
Yeah.
Find something that does connect
Mhm.
because it does need to be a little bit of a calling for you.
Yeah.
Don't do it for the money. There are other jobs that make more money than we do, clearly. So it does need to be a calling for sure.
Definitely. I 100% agree. Or maybe observation hours in the hospital where you put eyes physically on what we do on a day-to-day basis. Because I'm not going to lie to you, I got lucky and I loved the career, but I had no idea what I was getting into when I
Sure.
applied as a student.
Same.
Thankfully, it was for me, and I absolutely loved my job and my career in the hospital, but it's not for everybody. And I've
No.
seen students quit week 1, week 2 of clinics because they got barium on their shoe and they had no idea that that was an aspect of the career, but
Right.
it is meant for some people, and some people just excel and make such a big difference.
And that at the end trickles down to the patient. So, and that's why we are all supposed to be here. So,
Exactly.
yeah.
Why we're all here.
Okay. Yeah. Well, I appreciate you sharing that. That's incredible. So you talked about your radiography, journey, and then kind of skipped into that educator journey. I'm gonna table that for a minute. So, what called you over to CT? I heard you say pathology, which I love pathology. I taught that for years. But tell me about that CT, urging in your soul there.
So when I was working as an X-ray tech, I did absolutely love it, but some things felt a little bit limiting. But I loved the trauma, the fast-paced, the go, 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 always on the run with our patients. So I saw CT and I did some observation hours in CT, and I'm like, okay, CT deals with stroke, deals with trauma, sees all the exciting cases, but I get to see advanced imaging. I can see pathology that I cannot see in radiography. I can see the details. So learning pathology and getting to be an expert in that area made me feel more valuable to my patient. So if I catch something early and I flag it, or even sometimes, our doctors aren't perfect. Sometimes you say, "Hey, did you see that?" "No, I didn't see it." "Do you want to take a second look?" "Okay, let me see. What image are you looking at?" "I'm looking at image 101, for example." "Oh,
Yeah.
wow. Okay, you're right. Let me call the provider." And then you're like, "I did that. I
Yeah.
I caught that for the patient." So it just made me feel like 10 times more valuable, 10, and it was more exciting, more go, go, go. It's really everyone rolls through CT as they come into the hospital in one aspect or another. And then when we had patients like in critical care, we could image them from critical care to med surge to outpatient. And I'm like, wow, I remember when you rolled in. Look how much
Right.
better you are. And you just kind of get to keep track with your patients a little bit
Yeah.
better when you're in the hospital. And all those things really intrigued me. And I was like, I have to do this. I have to add this to my resume. And so I did it. I jumped in. I got a job offer with my clinical rotations. So I worked night shift as my first job ever, out completely on my own, which was really, really scary. So it was sink or
Mm-hmm.
swim. And
Mm-hmm.
I just kind of jumped in there. And ever since, I remember being a new tech and making mistakes and learning from my mistakes
Sure.
and making notes and keeping my little Bible with me since I was completely on my own. And then I transitioned into a more trauma, high acuity setting. And I went to day shift. So that's where I learned TAVRs and cardiacs. And I was like, I love my job. And the more I learned, the more I wanted to learn, the more I wanted to do, which is my good parts and bad parts of me. I always want to fill my plate, but I absolutely loved it, and I've been with it ever since. So yeah, teaching and scanning. I do miss scanning a lot in the hospital, but I get my little dose every now and then when I visit my patients in clinic. But yeah, absolutely loved it.
Wow. You know what I just heard and just saw that glow on your face is just that passion that again and all of that was you learning the next step and the next step and the next step and just hearing that passion and I'm that same way. I love to learn. Um not so much here's a book go learn because I'm going to be like watching paint dry or something. I'm active and I want to be where in the action. Trauma is my favorite too. So,
Definitely.
I mean, I learn so much because I'm hands-on and I'm just like totally all in it, and it is exciting. And you getting to share that as an educator with the next group and the next crop of technologists, how exciting that is.
And it's so exciting when you find a student who finds that same passion and they're like, wow, I really love this too. And I'm like, yes, you have it. You're going to be a great tech. And then seeing that student go from baby tech to lead tech, to
Yeah,
supervisor, to manager, to maybe educator, it's such a fantastic journey to watch. So we get the best of both worlds on this side.
100%,
Yeah.
100%, definitely.
Mhm.
Awesome. So you went into education, part-time clinical instructor, adjunct instructor, and then program director. So how different is that hat than the others that you wore?
Very, very different. The sense of responsibility that is on you, not only for your program success, but for your
Mhm,
student success,
mhm.
for the school's success, it's really just sits on your shoulder.
Yep,
And so I'm constantly evaluating my program. I'm constantly, coming to my students and saying, please do your evaluations. Tell me what's working. Tell me
yeah.
what's not working because nobody's perfect, right? We can all
Sure.
take in some
What's good
criticism
can
and
always be
learn from
great.
it.
Yeah.
Yeah, definitely, definitely. So I fooled myself thinking, oh, most of my courses are online. And once I have it set, it's going to be too easy. Absolutely not. I never go one semester to another without re recording lectures, without, reproducing my content. And I love
Awesome.
providing my students with resources. So I make study guides and games and flashcards and anything I can think of to make that
Interactive,
content
engaging. Yeah.
because just like you said, I can't read a book and
Mm-mm.
read the book and read the book. I can probably read a couple of pages and then I'm
I'm like off on, oh, yeah, look at that fly that got in the house here,
literally
yeah.
anything I can find to distract me from it, right?
Yes. It's paint drying. It's painful.
The visual guidance or hands on, I pick it up like this. There's nothing to it. So, being able to do that for my students is really important to me because we're not all the same. We don't learn the same. Everyone, so I'll give you the option. I just create as much content as I can because then that way the student has the option. Hey, I
Mhm.
learn best when I read the chapter. Fantastic. These are your objectives. Read the chapter. Here's your guideline for the assignments. Or I do lectures that have micro lectures embedded between little quiz aspects.
Neat.
So they can watch the entire lecture or they can read the chapter and say, hey, I'm struggling on this section of the chapter. Let me go to that section of her lecture and see if she can explain it better to me. So, those kind of things that I didn't necessarily have because we didn't have that technology when I was a student
Right?
is so exciting to me. And I'm going to start my doctorate in instructional design and online classroom building. So that's super exciting.
Wow.
Those are the
Congrats to you, ma'am.
Thank you. I'm so excited. I'm ready to do it. I just really want to be the best that I can be for my students
Mm,
and not only for my students, but for the career as a whole, because I don't want
uh,
to produce students who aren't going to be excellent in the clinical setting. As we get older, these are going to be the people who take care of us, and I want them to know what they're doing.
I just said that in a lecture last week. I mean, I'm 54 and I am the average age of technologists now. We're aging out of the profession and then we are becoming the patients of those behind us. So,
Yes.
absolutely.
I
But
need to know what you're doing if I'm the patient.
because you're going to hear from me if you aren't doing something right. No, wait, get somebody else in here. Get somebody else in here. Yep.
Yes, definitely.
So, I want to
And
circle back. Oh, no, go ahead, please.
I just have I think about situations in the hospital. Like I had when I was working at a freestanding for it was many years ago. I was doing a CT scan. A mother came in with a child and the child had fallen off the couch.
Mhm.
So she came in and the doctor ordered a CT scan of the head for the child. We did the scan and I saw a very, very small area that I thought was a bleed. So I waited for the report, which usually takes 4 minutes. The report came back before I even had the patient in the room, and I looked at the report, and the report was negative. And I'm like, So I called the ER physician and I said, hey, will you look at this image for me? I really think that this is a bleed. The ER doctor, looked at the report, and of course, he was like, no, the radiologist said it was good. So I could have left it at that, but on my heart, I said, no, I know what I'm looking at. He thought it was bone artifact. I did not think it was bone artifact. So I called the radiologist and I said, hey, please review these images for me. And if I'm not seeing what I think I'm seeing, can you show me what I am seeing? That way I don't
Yeah.
make the mistake in the future.
Yeah.
And so he said, okay, well, what are you looking at? I told him what I was looking at, pulls up the scans, and he said, let me call you right back. Didn't explain anything, hung up very quickly. And then 2 seconds later, I hear my ER physician's phone ringing. And then the ER physician came out and said, oh, you know what? You were right. We need to get the patient transferred to Texas Children's. And I was like, wow, just that indication. I know I'm good at my job and I'm going to advocate for my patient no matter what. And that's the kind of students I want to produce for the hospital.
Mhm. And
Yeah.
I won't use the word brave, but I am going to use the word brave enough to step up and say, hold on a minute.
Mm-hmm.
And I like what you said right there. If this is not what I'm seeing, can you please tell me what I'm seeing so that I am learning
Mm-hmm.
as well? And that's kind of where I wanted to go back what I heard and what you just said and that and prior is that it is important that we are still the patient advocate.
Definitely.
I mean, they spend the most time with us. They don't ever see the radiologist and they see the ER physician a minimal amount of time or their ordering physician.
Mm-hmm.
And they spend more time with us. And what I used to teach in patient care, often the patient will feel more comfortable speaking to us because we're Joe average. And so we're bringing them in, we're talking to them, we're getting some history, we're talking about their day, we're getting them on the table, getting them off. And so we need to open that door and invite them to say what is really on their heart.
Yeah.
And, this has been going on more than I told them,
Mm-hmm.
or this actually has happened a couple of times now, or whatever the case may be. But you being that next level and being that advocate, Risa, and calling, saying, know what, I'm just not feeling good about this.
Yeah.
Not just letting it go, thinking, well, they're the doctor and I'm not. It's their name on the report. Well, my name's on the report too as the technologist, but they're the ones reading it. And so if something happens, well, it's on them. But this was a child and you felt that. And he's like, wait a minute.
Oh, yeah. I'm going to flag.
We all need to do a better job of that. And if you're afraid of getting your rear handed to you and that's what's stopping you from advocating for your patient, maybe you need to rethink what you're doing because that's what you signed up for and you signed up to be the patient advocate first.
And I think
So,
it's how you say things, not what you're saying.
yes.
So I'm not saying, hey, you missed this.
No, not at all.
I'm saying like, hey, we're working together as a team. I could be absolutely 100% wrong,
Absolutely.
but I have an indication. And then show me. If I'm wrong, fantastic, but show me so I can be better in the future. And I think when you say it that way, they take it as you care, you're advocating for your patient and not I know more than you, because it's not the
Yeah.
case. The doctors spend years and years and years, but no
Yeah.
one's perfect. We all miss things. I'm sure I've missed plenty of things, but when you do
Same.
see it and you have that indication and you need to advocate for your patient, you need to be able to speak up for sure.
100%. 100%. Thank you for sharing that story. Just as a good reminder to all of us that, go with your gut and approach it objectively. Don't go in like I know more than you, just like you said, just like never would do that, and just go in. Can you explain to me what I'm seeing here? Because I'm understanding this to be maybe it's something and maybe it's not, maybe it's an artifact. I don't know, but can you explain to me what this is?
Yeah.
And just put it on the table for both of you, not me, you, I know more than you, anything like that. So
Yeah.
thanks so much for sharing that.
Absolutely.
Well, I'm going to switch gears a little bit, Risa. And, post pandemic world that we're living in, 2025, you just talked about how there are so many different avenues to teach. And, and different ways that you're exploring. I love you said the mini lecture on said area. I'm going to have to remember that. I love that. But anyway, I do want to talk about maybe different ways that we're delivering care now with technology and in a post-pandemic world, and talk about remote scanning of CT. Tell me what you know and what is going on in the world with that right now, and can you just share that?
Yeah. So, I mean, everything's changing, right? We have more technology, AI is coming into play. So we have to change with the times, right?
Yeah,
So as things are changing, as we're seeing shortages, as we're seeing an increasing patient load with the
yeah,
baby boomers coming into the hospitals now, I think a lot of hospitals are trying to get really creative on how to be more efficient. So with remote scanning, that allows one tech to sit at home and run the scanners, maybe one or two, while an x-ray tech is in the room, setting up the patient, getting the patient cleared, getting contrast set up, explaining the procedure to the patient, which takes a lot of the expert's time. So
Yeah.
now we're more efficient. We're running those rooms, and then an expert can sit at home, run the actual scan while communicating with the tech on site. How's the flow rate for your IV? Make sure that that tech on site knows how to identify an allergy. Make sure that they know the process and procedures that the patients need to understand and be aware of. Make sure we're getting proper clearance. Make sure we have a good patient history so we're doing the
Hmm.
right protocol for that patient. But another tech who is the expert or the CT scanner can efficiently run the scans as all the other tedious tasks are being done on site. And then that way we can scan more patients in less time, get more people on the schedule. Because I don't know if you had to schedule some imaging lately, it's usually a month wait, right? So the
It
more
is.
efficient, yeah,
It
the more
is.
efficient we become, the better we are and more capable of taking care of our patients. So this remote scanning is now becoming very, very popular. But we also need to be cautious with this because it is not a CT trained technologist on site. So we need to ensure that that tech on site has proper training, knows how to assess the IV site, knows how to identify allergies, knows, the proper procedures to take to keep our patients safe while that expert is at home scanning.
Okay.
So proper
So
training is super, super important in that aspect for sure.
definitely, definitely. So, in your experience and research, are you finding that facilities that are implementing remote scanning for CT are definitely putting an RT in the room with the patient, or are there other medical professionals that are taking on this role?
So far, especially if you follow ACR guidelines, they want a registered technologist on site. So far, I've seen remote scanning be done in training purposes. So
Okay.
instead of just scanning at home, you have CT techs on site. And let's say I'm a new tech, I'm scanning and I get a tab bar. And I'm like, I've never scanned this before.
Yeah.
So they'll have one super tech who gets to work remote or gets to work
Okay.
from a designated site. And me as a new tech, I would say, hey, Rayssa, can you help me through this scan?
Hmm.
Sure. So I will log on to their scanner and
Okay.
it'll be a twofer. So I can train them so they can be better equipped to scan it in the future
Wow.
and ensure that the patient is getting a proper scan at a diagnostic value. So it can be used in two ways for efficiency, for training, for, anything that these hospitals or clinical sites can come up with. But either way, I think it's very useful. And the technology is available, comes with most packages when you get a new scanner. So
Oh,
we should be
wow.
utilizing it the best we can.
That is incredible. I didn't know all of that. So you mentioned the ACRs. There are some ACR guidelines for CT remote scanning.
Mm-hmm.
Okay.
Definitely.
And are there any hiccups with CMS reimbursement that you are aware of?
Not that I'm aware of so far. I think this is so new in the implementation stages that it's not really widely used or widely known quite yet,
Okay.
but I see it growing quickly. I see a lot of people talking about it, and I see a lot of people, especially on the administrative level, turning their wheels. How can we utilize this? How can we use this to our benefit? What can we do with this?
Sure.
And especially people with a lot of campuses and a lot of new technologists, I think just with the training aspect of it would be a fantastic role to use.
I agree. I agree. Especially like you said, have like a super user
Yeah.
CT that is the one training these learning CT technologists. How beneficial that would be because not every CT student gets to work with someone like that. So it'd be good if you could standardize that level of learning. So
Yes. And right now they're looking at it as far as students too. So We're not counting remote scans as qualifying scans for
Okay.
clinical experience, but maybe we can get there at some point because if you know your computer in and out, you're going to be more beneficial to your patient. So I
Absolutely.
see that coming along too. So we'll see how it goes. But right now, I think it's in its baby phases and we're going to start to see it grow very quickly here.
Okay, thank you for that. Yeah, I'm interested to see, a year from now where we are with all of this and the regulations and whatnot. So
Mhm. With
awesome.
technology, I mean, everything, especially in medical imaging, right? We have to stay on the train. We have to just put our running shoes on, just keep up with it because it's just changing so quickly. And that makes me feel as an educator, I need to get out into the hospital and make sure I'm up to date with what is happening. What are the updates? What are the
Yeah.
changes? Because we need to effectively communicate those changes to
Mhm.
our students as well. And if they stay in the
Absolutely.
hospital for too long, I'm not sure how we can do that as effectively.
I completely agree with that with my educator hat on. And, before pre-COVID, but before I will say late 2000s, 2010 and before. Other than DR coming into our world, and I grew up on film, having to go back and learn that so I could teach it in the classroom. That was, I mean, technology did change, and yes, it changed, but not at all at the rate it's happening now. 3 months from now, there's going to be something different. 6 months from now, 9 months, a year, and it's crazy rate. And so, with the educator hat on, I'm saying don't lose touch with your clinical connections and say, "Hey, can I come observe for a day or two? I need to see this, and I have questions about this."
Yeah.
So, yeah, it is
I don't
happening
know if you've
rapidly.
seen with the portable X-ray units now that they can do dynamic where you can see motion. So like for orthopedics, we can open and close the joints and see more efficiently what's going on in those modal or the extremities, or in the spine. You can do flexion extension and you can see it physically moving. We have digital grid now where you don't need to put a grid and the computer will delete suboptimal pixels from your image. Yes.
What?
This is what amazes me so
And you
much
don't need a
about it.
C-arm to do this.
No
Oh, it's
C-arm. It's
crazy.
literally a portable unit. I'm sure you remember what our portable units looked like when we first entered the field.
With the washing machine dials, yes, that and they would take a beating, but yeah, that's what I learned on. You could hear that thing coming 2 miles away.
Mhm. And we'd have to go process our film, come back,
Yeah,
process the film.
yeah.
God forbid we had to repeat because that
Woo!
was another mile. But hey, we got our steps in, right?
We did, and we learned to be good at our positioning and techniques.
Definitely. Definitely, because we don't want to take that extra
Woo!
trip out, the walk of
Yeah,
shame. I need to do it one more time. I'm so sorry.
right, right, right.
Yes.
Technology's come a long way since then.
Mhm.
Wow. So, talking about the remote scanning, CT remote scanning for the radiologic technologist, we are so blessed here at AHEC to have Rayssa as one of our faculty on our team. And this is actually, it's a 4 hour class? Is that
Yeah.
right?
Mhm.
A 4 hour class via webinar that Risa has created for us. And I know that it is a brand new class. And we've run it a time, I think, once, and we've got some more dates coming up. Can you talk about the class a little bit and what someone out there that might be interested maybe learn from that class?
Yeah, so the class basically prepares an RT or let's say a tech assistant if a facility would allow that
Okay.
to identify protocol procedures.
Hmm.
So let's say my patient is having tachycardia and chest pain, and the doctor orders a dissection protocol.
Okay.
We should be able to say, hey, I don't think that this is the right protocol. I think we need to do a PE protocol or something to that extent. So, one, be familiar with the protocols that we use
Hmm.
and the indications that tell us, hey, this is the proper protocol to use. It also teaches you about the different types of contrast that we can administer and how to administer them,
Right.
reactions that can occur after administering the contrast,
Okay.
making sure that we do proper patient screening. So, if my patient is on certain medications or has certain medical backgrounds, are they safe to receive the contrast? Because that tech on site needs
Oh,
to be
wow.
able to
Yeah.
do that. We go over some IV procedures, so how to properly place an IV in the patient, and how to make sure that you maintain a sterile and safe field so you're not causing infections to the patient. We also teach how to identify extravasations if they do occur, and if they do occur, how to properly document and treat those extravasations.
Great.
So basically, how to prepare your room, what equipment you're going to be using, how to use that equipment when you're on site.
Mhm.
We don't go too deep into actually scanning the patient because, of course, the CT tech would be at home doing the physical
Right.
scan. But I want them to be as well rounded as they can be without that scanning component. So just because they're not physically pushing the button and performing the scan itself, I want them to be completely confident in running that room as if they were the CT tech in that room.
Gotcha. Gotcha. So this is definitely for that on-site technologist,
Definitely.
and maybe someone who is going to be up and coming learning in the field of CT and how they can maybe start that pathway before they start a program or a course in being an actual CT technologist.
This could maybe ignite that fuel in you to make you want to advance your career like we all should,
Mhm.
because radiography does offer that to us, right? And seeing it and being able to work on site without actually going through the program yet could show you, hey, this is really for me. I really feel like this is interesting, or maybe this isn't for me. Maybe I can
Right.
do radiography. But either way, it's a great experience, great learning experience, great thing to put on your resume. So definitely for that person who wants to advance their career or
Mhm.
just learn a new modality or just do something different other than x-ray.
Yeah.
Hmm.
Awesome. Awesome. I like how you said that advance your career. So that's definitely a door to do that. And as we know, being a technologist, I have so many options
Yeah.
to advancing my career. So,
Hmm.
well, great. So, Risa, the next thing is you said you're starting your doctorate. Where are you going to be starting that at?
I've put in my application and completed all my onboarding for South College. So
Nice.
it's a Doctor of Education in Instructional Design. I will officially be starting with September of this year. After the craziness of our summer semester is over, then maybe I can dedicate a little bit more time. But I'm really right now in that planning process. What is this going to look like? What is my timeline going to look like? What is my schedule going to look like? So I'm in that phase of it right now.
I understand another new planning phase. So,
Yeah.
trying to set homework and family, everything, everybody up for that on all their schedules. But we wish you so well. And I know you're going to do amazing and look forward to the new content that you're going to bring to us at AHEC for our learners and all the changes, rapid technology changes in CT and in radiography. So, we again are so thankful to have you on our team.
Thank you. I appreciate that.
Well, Risa, I want to just thank you for taking time out of your busy schedule to be with us on the Radiology Roundup. Risa, you will, if you're in the greater Houston area, I know you know her, and she is the CT program director at Galveston College. Go to their website and check out their program. Um, Look for Rice's course with us, remote CT scanning for the radiologic technologist on AHEC Online. And we look forward to what you're going to bring to us in the future, Risa.
I look forward to building it for sure. I love doing what we
Super.
do.
I love doing what we do. And I'm so, again, thankful to have you on our team.
Thank you, Melanie. Thank you for having me.
Hey, y'all. Melanie Hale here with Advanced Health Education Center in Houston, Texas. AHEC has been a leading provider of continuing education for healthcare professionals in the imaging sciences since 1988. Our mission is to provide you, the radiologic technologist, physician, sonographer, nurse, and allied health professional with evidence-based education and training that increases your knowledge, enhances your competency, and overall improves patient care. Technologists, has the time come to learn a new modality? Are you limited in your resources and, more importantly, time available to learn a new modality? AHEC is here to help. We have online and in person delivery methods available for mammography, bone densitometry, sonography, CT, and MRI. AHEC also offers CME for physicians, including in person ultrasound training. We have continuing education available via live webinar, on demand, at home study, and in person. We offer specialized corporate training classes both online and in person. Do you have a specific staff training need? We will come to you. Want to host a continuing education event for your staff and community? Hey, we do that too. Did you know AHEC also offers mammography consulting services? We provide on-site services to assist with regulatory inspection issues as well as accreditation reviews. Our consultants can design an acceptable compliance plan or a plan of action to correct deficiencies specific to your facility. Check us out at aheconline.com. Check us out wherever you social, like, follow, subscribe, and stay in touch with the many course offerings, events, and stackable learning courses we offer. Have a specific need? Give us a call at the office, 800-239-1361. Make the change from cheap continuing education to affordable quality education that you can use. It's time to invest in yourself. Hey guys, in today's takeaways from my guest, Rayssa Salinas, she hit on so many things that really touched my heart and hit home for me. One thing she talked about is having a connection in what you're doing. Um, we live in such a different world than just a couple of years ago, and especially 5, 10, 15, 20 years ago. And for my technologists that are listening, remember why we got into this. I remember why I got into this and then moved over to education and my passion for sharing with others. I still have that. My role has changed a little as time has gone on, but I still have a passion for what I'm doing. And I think it's important that you don't lose that. We have all been in jobs, even in this world, in this field, that has burned us out, or maybe it was management, or maybe it was something like that made us move on. But whatever it is you're doing, you should have an unspoken connection to. Gosh, back in 1990, I'm dating myself. You didn't get into radiology for the money because we didn't, when I graduated, there wasn't, the pay was not great. The pay is definitely much better now. It's good. It is not super fat, but it is a good wage to have now. And for those of you that are seasoned technologists like me, or maybe you've been in it for a few years, or maybe you're going into it, you need to make sure that you are connecting to what you're doing. And if you aren't, as we talked about, being a radiologic technologist, there's so many other things you can do. If it is not day to day patient care, or maybe you're in trauma and it's time to move on to something else, MRI or mammography, maybe you're a radiation therapist and it's just a little more overwhelming than you anticipated. Maybe dosimetry and helping on from that angle is your calling. Or maybe it's time to get into applications or sales or become an educator. But find your niche and what is a calling to you. Because with this degree, as we have said countless times, and we'll say again, you can do so many things. And so find your niche, find your passion. So few of us are born wealthy, so the rest of us need to get up and go to work. So find something you're connecting with and that you feel that excitement and not just feeling burnout or oh gosh, I hate my job or and second part of this, don't get on social medias and blast radiography or radiology or whatever or this clinical site or that site. If it is that bad that you've got to vent on socials, then maybe you need to find something else that is making you happy and bringing peace and joy to you. For you educators, and so love her little tip. Maybe you guys are already doing this, but when I was teaching online in my last job, I didn't have this. So great tip, and I wrote it down. Um, you do an online lecture, it's recorded, okay, but and maybe I'm going to give an example. Say, patient care chapter 3, this page to that page. Here's my lecture. Well, on this particular subcategory, have a mini lecture on that. Chase that rabbit hole there. Have another mini lecture on the next section, and so on. And the student that needs that deeper dive has that extra bit of information directly from you. And of course, then they can set up tutoring or additional time with you if they need to. But I love the idea of the sub lecture or the mini lecture within that greater content that one is lecturing over. So she gave that great little tip, and definitely something I would use if teaching in the classroom or virtual classroom. Again, great tip. Something in a sidebar to that, we all learn differently. Um, and this is something that in new content we're creating at AHEC that is very important to me with the faculty that we're creating this new content. It has to be engaging because anybody can read a bunch of PowerPoint slides to the audience and go slide to slide to slide and read, but it's the stories, it's your excitement, it is your engaging with that virtual audience that is going to be watching this or live or recorded. And it is so important to have that ready. um, Engagement is everything. And I'm thankful that in the online teaching world, I actually learned how to overcome my obstacles way before COVID, because I am very much a classroom, hands on, clinic, lab, lecturer, in your face, moving my arms, telling a story, doing my thing. And at first I thought, oh, I can't do this. I can't do this online. It was a big learning curve for me. But I realized, well, I can still be me. I can still talk. I can still tell a story. I can still laugh. I can still be fun. And, a couple of tips I gave to someone recently who was learning to record webinar or do things new online. If you can't look at yourself and talk or imagine your audience that's going to be watching this, then put a picture of some students up above your monitor, up above your camera. Put a picture of your family, or whoever your friend is that you want to tell this amazing new subject matter to. So it can be maybe a little more engaging. You don't want to be a slide reader. Anybody can do that. And every now and then, if I'm doing a lecture that includes a lot of data, yeah, I have to read some slides a little bit, but I will skip around and still try to make it fun even when we're doing that. So you know, be engaging. Everybody learns differently. Some auditory, some visual, some kinesthetic, some are somewhere in the middle of all of it. Some change day to day. And you know me, I'm changing every day. Some days I may not hear you, but I see you and I want to practice. And then some days I'm using all of my skills. And so maybe you need to have something that they can write on, something that they can highlight electronically. Utilize those different avenues if possible. Make a game, make it interactive, use, an app. Just be engaging and think about that learner and how hard it may be, especially someone if it were my age that were just going back to school. And yes, I'm not trying to put us age in a group, but technology is crazy now. And if you don't use any of these things all the time, it's very challenging. It's already hard to go back to school or to learn something new and then try to learn new technology too. So bring it all in. Try all the new, the old, and make it super exciting. That kind of leads into my next point. Be adaptable as an educator or a teacher. Technology changes so rapidly now. I mean, as we said earlier, 3 months from now, there could be another new platform. There could be another new app. There could be another way to learn a textbook or whatever. Um, Gosh, it's changing so fast. What everybody's doing right now today might be different a year from now and could be significantly different. Technology is just going so fast every day. And can you keep up with all of it? Probably not. But stay in the loop as much as you can. I am not really, other than Facebook, I'm not a big social media person. LinkedIn and Facebook, that's about it. But I know that so many people are using all the platforms now: TikTok, Insta, Facebook, YouTube, Threads. There's something Lemonade. I'm learning about this. And so, anyway, you can't be stagnant is the point, and you need to be adaptable and meet people where they are. um, maybe your potential new audience is only using TikTok, and I'm still figuring that out, by the way. But you've got to be able to reach people where they are, and really keep them engaged. It's very important. uh, Engaging, more inviting learning environment, safe environment. I know, like at AHEC, for some of our new content and courses, we're creating private share points, a community where learners in a particular group or class can, once the course is over, they can chat with one another, they can chat with the faculty. It is a safe environment to do so, and not be getting maybe some crazy advice, like, if you go to Facebook and post as an anonymous member 097, in whatever group. You never know what kind of advice you're getting there. But like some of our courses here at AHEC, that's yet another tool that we can reach our people regardless of where they are. They can take what we've taught them, take it out into the clinical environment, and then come back and say, hey, this happened to me today. Have y'all ever experienced this? Or this is a new protocol for us. Can anyone give me some insight on this? And it'd be a safe place to do that. We put other tools and downloadable, printable workbook. Again, utilizing all those different learning styles that the learner may connect best with, not just lecturing. So, letting them, review the recorded lecture over and over again as much as they want to. Plug in that transcript to AI and make note cards, or, I'm weak in physics, and so I really need to plug that section into notes for me so I can dig deeper. So, really, it's important to meet people where they are and be adaptable. Yeah, I've said it before. Well, we've all the attitude, we've always done it this way, and we're not going to buy into this new way of doing things just because other people are doing it. That's going to get you left behind. And I hope that all my educators and lecturers out there definitely give it a chance. And it's okay if someone younger than you teaches you how to use it. Maybe I have to get my kids in here, show me how this works. I'm not sure how this works, and go slow so I can follow along with you. It may be that, but that's okay. We never need to stop learning, whether it's technology or um, clinical practice or whatever. We never need to stop learning. We always need to learn and keep our minds fresh and connected to our world, because we are a very unique and amazing group. Thank you so much for joining me today. I want to thank Rayssa Salinas for joining us. Please check out her class with AHEC, uh, remote CT scanning for the radiologic technologist. It's a 4-hour continuing education class. You can find it on aheconline.com. Thank you to John Largent, my producer. I'm just so grateful to have you with me on this journey, and your advice and direction, and your team at Largent Media. Y'all are amazing, and I appreciate your support and all the great things that y'all edit out of my stammerings. I appreciate it. You guys are great. Guys out there, spread kindness. Everybody's going through something, regardless if they got a smile painted on their face or not. Be kind and understanding, and check us back wherever you podcast. Make us one of your favorites. Subscribe, like, please leave us a 5-star review, and share with your colleagues. Share with those professional friends that you care about. And send us a message if there are specific folks you would like to see or topics. I am wide open. We've got some really cool people coming up. Had some cool ones. We got some cool ones coming up. So send me a message, and I'll look forward to hearing from you. Peace, love, and rad, y'all.